for us as oncologists, anything which is abnormal, anything which is staying for a long period, anything which is not responding to your normal treatment, that is all that you should keep in your mind. So just to give you some examples, any abnormal swelling in the breast region, any abnormal swelling in the neck should be your first red flag. Any abnormal bleeding, so that bleeding could be either in case of women, it could be from the nipple area, or it could be out of the time menstrual heavy period. It could be any abnormal bleeding in your cuff or in your stools. All this would, be a very significant finding for me as an oncologist. The third would be any non-healing ulcer. So ulcer is anything which is bleeding or is painful to touch. So anything which persists for a long time, does not heal, would be a red flag for me. And this most commonly is seen in the head neck region, where we most commonly have cancer. So COVID actually impacted a lot of, it did not allow a lot of early diagnosis of cancer to happen. The patients were not able to visit the doctor to diagnose their symptoms. Those who were diagnosed with cancers could not reach the hospital to seek treatment. Those who were continuing their treatment were afraid to come to the hospital. Many times the hospitals were not accepting people. A lot of our cancer beds were taken away because we were a COVID hospital. So all these things made cancer care, it impacted it a lot during the last 8 months. So the cancer treatment in our country is very heterogeneous. What I mean to say is that at patches, it's at par and almost comparable to the best in the West. And this I mean by the treatment that we offer in our metro cities. But when it comes to the grassroots, we are nowhere close to even providing the basic health services, let alone cancer be. So I can just put it this way, that those who are able to seek treatment, those who are able to get diagnosed in time, they will actually be able to get the best treatment possible. And affordability is a big factor. But non-availability and limited resources make it a challenge, especially in the rural setup. So it's a real challenge for us as doctors and the government to allow resources to. So there are some factors which cause cancer which are not in our control. Like, we probably cannot control our genes that we inherit. We cannot control some unforeseen circumstances. But yes, there are some avoidable things which, if we do, which can actually reduce your chances of getting cancer. So, for example, I take that the most common cancer amongst men is head and neck cancer, and most of it is attributable to tobacco. Now, this tobacco can either be in the form of smoking or it can be in the form of chewing. All these leads can be avoided. Now, in case of women, the second most common cancer after breast is the cervical cancer. Now, cervical cancer actually has a proven vaccine available. Getting that vaccine will not make you completely immune to that cancer, but it will definitely reduce the risk of acquiring those cancers. So, doing little things can make a big change in one person's life actually. So, what I think we should look at is we can thank COVID for highlighting the healthcare, and which has been reflected in the budget also with the steep hike that we have got in healthcare. But the thing that we should look for inspiration is how we have enhanced the health infrastructure due to COVID. We had emergency beds coming up, we had emergency investigations being done, a vaccine was developed in less than a year, we had equipment which was flown in from other countries. So for treating cancer, actually, you don't even need that much things. You just need to have the proper guidance and the proper perspective to bring it. We really have most of the infrastructure that is already required. It is just that we need to push it with the right intention so that we ensure that the healthcare reaches to the people who actually need. That is what I think should be our goal for the next 1 year.